ID him, make sure I got the right guy, right? Because when I was drawing it up, what did I check to make sure it was the right patient?
The MAR.
I checked the doctor's order and the MAR, okay? And when I was, prior to drawing it up, I did my first check. Drawing it up, I did my second check, and before I put it down or away, I did my third check. Okay, don't forget your stuff you already know. All right. All right. So I'm going to give John his medication. All right, John. I'm going to give you something for pain. It's going to act very quickly. Okay. It might make you sleepy, so I don't want you to get up. Okay. And I'm going to check your IV first. And I'm going to give you some fluid first to make sure it's okay. Do you have any pain here? No. It was just put in. All right. He has no swelling. It's warm to touch. It's not cold. All right, so I've checked for phlebitis, infection, and infiltration. All right, so nothing. So he's got a port on the end here. I'm going to clean this port, whatever port you're using, for 15 seconds with alcohol, and I'm going to let it dry. Okay? Everybody has used these flush syringes before? Open them up, pull them back first, then flush the air out until you have, you know, fluid in the top. Because if you just shove them, you're going to decorate the ceiling. Okay? Because they catch. All right? So I'm going to give John how many mLs?
2.
Okay. I'm going to give him 2 mLs. Over a specific amount of time? Not really. I'm going to clean his port again. 15 seconds, obnoxious seconds. I'm going to let it dry. Okay, sing yourself a song, whatever it takes for you to do 15 seconds. I've got his fentanyl. Okay, now I'm going to give a half over each minute for 3 minutes. So I'm going to give a half. I'm actually going to watch my watch. I'm going to wait a minute. Give another half. I'm going to wait for another minute. I'm going to give my third half. Now I'm going to wait for a minute before I give the flush, okay? So I've got this minute. While I've got that little minute, I'm going to clean my port for 15 seconds. Let it dry. All right, I've got my other flush. Make sure you pull back, flush it, put it on your port. How much am I giving? 2 mLs. I'm going to make sure I stay with my patient for at least a minute, and I'm going to check John. How are you doing, John? Wow, that stuff's good. It's really working fast. My leg already feels like, do I have a leg? I don't know. Okay. I love it. All right, so I'll make sure his IV looks okay and everything's good. All right. When do I want to return to check John? When does it peak?
3 to 5 minutes.
3 to 5 minutes. So within 5 minutes, I'm going to come back and check him. What do I want to check now after I give him this medication? Definitely I want my vital signs, including pain score. Okay. How are you feeling? Don't try and get up. Remember, this lasts for a good hour. Hopefully you'll be in surgery by then and they'll be repairing your leg. Okay? Good boy, John. All right. Okay. All right, so somebody in the meantime came in and hung an IV of normalcy. All right? So you want to clean the port for 15 seconds with alcohol. Let it dry. Okay? With a compatible IV. Now, that means fentanyl is compatible with what's running in it. Put your flush on. Now how much am I giving? 4 mLs. Okay, I'm going to give 4 mLs. I do not have to pause the IV. I don't have to pinch the IV. It's okay because it's compatible with the fluid. Okay, so I give 4. I'm going to give my fentanyl. How am I going to give it? A half. Wait a minute. A half. Wait a minute. A half. Wait a minute. Port again. Put my flush. How much flush am I giving?
4 mLs.
4 mLs. I'm done. All right. Now they hung an IV solution that is not compatible with fentanyl. But I still want to give him his medication. process is very much the same. However, I know it's not compatible, so I have to use more flush, right? And I need to pinch the line and put it on pause. Pinch the line, keep it pinched the whole time, leave it on pause, clean the port, give my 10 mLs of flush, clean the port, let it dry, give my fentanyl like we said before, a half, wait a minute, a half, wait a minute, a half, wait a minute, clean the port, give 10 mLs of flush, unpinch my line, restart my IV. No mystery, right? So, non-compatible, it's 4 mLs, you don't have to pinch or pause the IV fluid. Compatible, or non-compatible, you need to make sure you pinch it off, pause the line, give your 10 before and after to make sure you clear that line, unpinch it, and restart your IV. Yeah, comfortable? Okay. Alright, now John went to surgery. They set his leg, he's in traction. And while he was in surgery, he was such a mess, they went ahead and put in a CVC. So he's got a central catheter now. He's waking up from surgery and he needs another dose of fentanyl. This time he needs it through his central line. What do we need? Oh, that nurse did not open that with her teeth. What do we need to check on the central line? What are we worried about? We need to look at it before we're gonna give his fentanyl to him. What do we need to check on that line? He just came from CVC, come on. What are we looking for? Any bleeding? Yeah, so line just put in too, right? Redness, swelling, crepitance, heat or coolness or any kind of purulent drainage, right? Okay, we're checking that. When you feel crepitance, it feels like Rice Krispies under their skin. What is that? What's under there? Air. They have an air embolism, okay? And what else? What else did I check for? Yeah, and you know you have to, yeah, hopefully he's not having any of that, right? Shortness, breath, or chest pain. You also need to make sure he doesn't have swelling in that arm on the side where that is, because sometimes you can have an occlusion in the central line and their arm will swell. That takes time though, probably not on a fresh line. Okay? Alright, so we're gonna give John, his CVC looks good, and we're gonna give him his fentanyl, because he's begging for it. Okay, he's like, give me some of that good stuff that I had pre-op. Okay? My leg's still hurting me. Alright, so he has a 10 out of 10 pain scale. You got his vital signs, his respiratory rate, his heart rate, and his blood pressure are stable, so you can give it to him. Alright? What do you need to check first before you even go for the line? Are they clamped? And what else? Are the caps on tight? Okay? Check them all. Check them all. Are the caps on? Because what happens if I unclamp that and the cap's not on? Boom, he's gonna bleed out. How fast do you think he's gonna bleed out of his right atrium? Really fast, okay? Before you can even get your hand back on the clamp. Okay, I'm gonna switch sides. Sorry, you're in the camera. Alright, so I'm gonna choose a port. Some ports are designated for meds, others it doesn't matter. And he's got a triple port, so I'm gonna choose a port. Oh goody, do I have to have gloves on? Sterile gloves? I should wash my hands, non-sterile gloves, okay? If you want to use non-sterile gloves, same thing over here. Make sure you wash your hands, put on your gloves, and wash your hands after your gloves, right? Alright, so I have gloves on and I am cleaning the port. How long?
15 seconds.
15 seconds. I have to sing happy birthday or something. That's a good 15 seconds. Alright, let it dry. And I'm going to use how much flush? And so pull back. Get your flush ready. Alright. Before I flush, I'm going to do what? No, I'm going to pull back. I'm going to get blood return. I don't wanna pull all the way into my flush, I just wanna pull enough to know that that line is patent and it pulls back. Now I wanna flush, how do I wanna give it? Push, pause, push, pause, push, pause, push, pause, push, pause, all the way down to 10. If this was my last flush, I would clamp my line, but I'm not going to because I'm gonna give his fentanyl. Alright, I gave his 10. What do I have to do? Clean the port. Every time you're gonna go put a new syringe on it, clean it, 15 seconds. Let it dry. I've got my fentanyl now and I'm gonna start giving it. Alright. I'm gonna give a half. I'm gonna wait a minute. I'm gonna give a half. I'm gonna wait a minute. I'm gonna give the last half. I'm gonna wait a minute before I do my next flush. I'm gonna clean my port. Yay, obnoxious, right? Until you get endocarditis because somebody put something in your line. Alright, so I've got 15 seconds. I let it dry. I'm ready to do my next flush. Pull back. Make sure you get air out. Who wants an air embolism? Push pause, push pause, push pause, push pause, till I get my whole 10. The last half ml, what am I gonna do? I'm gonna clamp it, my last half out ml. As I'm giving the last half, I'm gonna clamp it at the same time. Okay, that keeps blood from backing up into your line and causing all kinds of fun things, like clots being shoved into the line, okay? Push pause when you're giving your flush. Okay, why do we need push pause? Then just, because you have a blood pressure and this thing's in your right heart, okay? So blood wants to return, okay? So you're pulsing it. Push pause the last half, clamp at the same time, and push, right? Okay.
So
That
for
way my
this-
line does not get blood backed up in it.
For this one, we don't have to lay the patient down and remove the pillow.
No, like you did for CVC,
Yeah.
how you had to lay him down
Yeah.
and everything. No, because you are not taking caps off, you're not opening lines to the air, okay? When you're gonna have a cap open, or you're gonna have something open to the air, they need to be
Yes.
flat. So there's a risk of not sucking air in, okay? Yeah. That's the risk of CVC. So this guy does not have to be in any particular position. Other than now I have him loaded up on fentanyl again. I don't want him moving. Okay, I don't want him getting up by himself. There's a risk of falling and all that. Alright, so when do I wanna check him again? I wanna stay with him for at least a minute. I don't care what drug you're talking about. And then, when does this peak? 3 to 5 minutes. Okay, so I wanna come back and check him in 5 minutes. I wanna recheck his vital signs. I wanna recheck his pain level and see where he's at. Okay, and I know I better get my little hiney in there in about an hour and see how he's doing because it's gonna wear off. Okay? Questions? So now you've done saline, compatible IV, non-compatible IV, and central line.